Dr. Muniyappa, it's nice to meet you.
Nice to meet you.
Is it Gillian Sanders?
It is, yes.
Nice to meet you, Gillian. How can I help you today?
Well, I've come in really because I'm a bit concerned because I've been getting some headaches, and I was just a bit worried about them.
How long have you been getting your headaches for?
Roughly, I would say about 3 weeks.
And before that, did you have any headaches?
No.
Okay. Can you describe your headache to me?
Well, they start, and I feel it's round the sides and just at the front, and it's almost as though, you know, when you just feel like some hands are squeezing.
Okay.
That's how it feels.
Okay. Does it go anywhere, like round the back or into your neck?
No.
Okay. Are they lasting the whole day or a few hours?
No, I'd say they probably last about 2 to 3 hours.
And do you have them more than once in a day?
No, it's usually just once a day.
Does it happen any particular time in the day?
Usually afternoons. I don't wake up with it. It's usually sort of after lunchtime, so yeah, afternoons.
Okay. And you mentioned you don't wake up with them, but do they wake you up at night time?
No.
No? Do you have any other symptoms with your headache?
Like what, sorry?
Like, do you feel sick or have you vomited at all?
No.
Any problems seeing with your headache?
No.
Any problems with loud sounds with your headache?
No.
And how about bright lights? Do they affect you in any way?
No, they don't seem to.
No. Have you had any weakness in your arms or legs, or numbness in your arms or legs?
No.
Dr. Anu starts well with open questions and moves on to closed questions.
Okay. And you mentioned right at the beginning that you were worried about your headaches. What were you worried about?
Dr. Anu picks up on the cue that was initially mentioned.
Well, because I've been having them for a while, I was listening to the radio the other day, and they were doing one of those, those programmes where people phone in and tell their problems.
Yeah.
And there was a man that phoned up saying that he'd been getting these headaches for a few weeks. It's probably been a few months, and it ended up being a brain tumour.
Okay. And apart from a brain tumour, was there anything else that you were worried about?
No.
Okay.
I just didn't know. I didn't know what could be done, whether, with blood tests or whether a scan or...
Okay.
I think I'm just panicking.
Okay, so you've had a think about it, and you mentioned blood tests and scans. Was there anything else that you thought I might do today?
The doctor asks all the ideas, concerns and expectation questions together at the same time.
No, I did go to the opticians.
Okay.
Because I know that sometimes it can be a vision, because I wear contacts, you see, and I wear glasses as well, so I didn't know whether my prescription had changed, but when they checked me, they said there was nothing wrong with my eyes.
Okay, great. So have you noticed any problems with your weight?
No.
No weight loss, and your appetite, is that okay?
Yeah, fine.
Now, looking at the medical records, we can see here that you're usually fit and well. We've got no medical problems recorded for you. Are you taking any medication for your headaches at the moment?
I've been taking paracetamol, but I don't know whether they're not strong enough or what, but I take sort of them 3 times a day.
Okay.
Up to 3 times a day, and they're not touching them.
And have you done that every day for the last 3 weeks once you've had your headache?
Yeah.
Okay. Are you allergic to anything?
Not that I know of.
Okay. And do you take anything over the counter?
No.
Is there any family history of any problems like brain tumours or any problems you think may be significant?
Not that I can think of, no.
Okay. Just about you in general now, work-wise, are you working?
Yes, I'm a social worker.
Okay, and how is that? Do you enjoy that job?
Well, I did until there was about 2 months ago, and there was a lot of redundancies.
Right.
Thankfully, I wasn't affected by that, but because of that, my workload's got a lot bigger, really. So
Okay.
I've got a lot of extra work.
Is that stressful?
It can, well, yes, it is, because I had enough work as it was.
Yeah.
But now that I've had all this new work come on as well, I do find that it is quite stressful from the second I get to work till the end of the day, and I do find that I'm thinking about it when I get home as well.
So it sounds like it's hard for you to switch off.
Oh,
from
definitely.
that when you
It's
come
quite a
home.
hard job anyway, being a social worker, but
can
with the
imagine.
extra workload, it's...
Okay. Sometimes when people are very stressed, it can affect their mood. Has it affected your mood in any way?
Dr. Anu demonstrates a nice way of asking about depression by linking it to the patient's current issues.
Low at all?
Not that I can think of. I still like to... Well, I'm still doing everything that I was before, so I'm still going out with everybody, and... Yeah.
Okay. Do you smoke at all?
No.
Gillian? And any alcohol on a weekly basis?
No.
Who lives with you at home?
I live on my own.
Okay. Right then, so what I'd like to do next is to examine you, if that's okay. So I'd like to check your blood pressure first. I'd like to have a look at the back of your eyes and then just check the nerves in your face and your arms and legs, if that's okay.
No, that's perfect. Thank you.
Okay. So the good news is that all your examination findings were fine. They're all perfect, which is really good news.
In our consultations, it is very easy to fall into the trap of turning normal examination findings into a negative light. Here, Dr. Anu highlights that the normal examination findings are a positive finding as opposed to a negative one.
Okay.
Oh, good.
Do you feel a bit relieved?
Like to, yeah.
Yeah, okay, fantastic. So from the description of your headaches, it fits with something called a tension headache. Have you heard of that before?
No, I haven't.
Okay. Now, tension headaches is when you've got tightening of some of the muscles around your head and sometimes into your neck and your shoulder regions. And when they tense up, it can cause this squeezing-like sensation that you've described and cause the headaches that you are describing. Now, you mentioned specifically about brain tumours. Something had worried you and you thought about brain tumours, but they are very, very rare. And your symptoms don't tend to fit with a brain tumour.
Dr. Anu tackles the concerns expressed by the patient quite early on in the management section.
So you don't think I need sort of a scan or anything like that?
At this point in time, no. There's nothing there from examining you and talking to you that makes me think that you need a scan, but I think we do need to address some of the things that may be causing your tension headaches, if that's okay.
Yeah, that's fine. Does that mean medication or just...
Sure. Well, there's lots of ways we can manage it, but from talking to you, it sounds like your work seems to be quite stressful at the moment, and we find a lot of people with tension type headaches, there's a stress trigger, and I wonder if it's work that's causing it. What do you think?
It could.
Dr. Anu floats the idea of work as a potential trigger to help come up with a joint management plan with the patient.
It could be. How would I get around that? Because I can't, it's really difficult because the workload is so much, I can't give it to anybody else. Or...
Sure. Well, there are relaxation techniques that I can give you, so some self-help. We can have a chat about tablets. Time off work may be an option if you think that would help you.
By listing the management options, Dr. Anu demonstrates to the examiner that she knows what the management is. This also allows the consultation to be patient-centred and allows the patient to choose the appropriate management option.
If I take the time off work, everyone else is going to have to pick up what I'm doing, and I'm not sure if I'd feel more stress thinking about everyone else having to have all the work.
Well, we'll keep that on the back burner. We can have a chat about the other options.
Yeah,
so firstly, relaxation techniques. I can give you some information about some techniques that you can do just to help relax yourself.
And I can do that at home.
You can do that at home, so that can be one of the first things. And medication. Now, you mentioned paracetamol and you've been taking it quite regularly. It doesn't seem to be affecting.
No.
Sometimes with regular use of paracetamol, you can get a headache on top of your headache, so it may be worth actually just stopping that. Are you able to use ibuprofen?
I think I've used it before.
Okay, it may be worth just switching over to ibuprofen.
Is that
instead.
just a stronger paracetamol? Or?
It's a different type of medication to paracetamol. So if you stop your paracetamol altogether and switch over to ibuprofen instead. Some of the side effects with ibuprofen are stomach upset, so just make sure you take it on a full stomach, and if you start getting any indigestion or stomach pains, you might need to stop that and let us know. So if it works, then fine, but I think realistically if your stress carries on, you are at risk of carrying on having these headaches, so it may be worth, if we give you the relaxation techniques and you make that switch over to a different medication, and maybe getting you back to see me in a couple of weeks' time so you can tell me how you're getting on.
Yeah, if for example it hasn't got better, what would happen then?
If it hasn't got better, there are other medication that we can have a look at. So there are tablets that you can take on more of a daily basis to prevent your headaches coming on. So that may be an option if your headaches are still persisting.
Yeah, and yes, again, if that doesn't work, is that when you might look into other causes?
Sure. So if after all of that things are persisting, or even if there is a change in your symptoms, it's worth just coming to let us know so that we can just reassess things. In terms of the brain tumour, I think you're probably...
Dr. Anu picks up again on the cue that the patient may still be concerned about a brain tumour and tries to reassure her again.
Still thinking about that. It's very, very, very rare. So I can give you some information if you'd like about tension headaches to take away and read about. And if you want some information about tumours, we can give that to you, but I don't think at the moment that's a good idea. It does seem like it's more.
Good idea for me to look it up, or
you can have a look on the NHS website, or patient.co.uk is another good site. Sometimes when you just Google it, it can come up with the most rare and scariest things, absolutely. It may not be a good idea just to look at any random website. But
the internet contains vast amounts of information, some of which is correct, some of which is incorrect. It is always important when directing a patient to online resources to make sure that they are appropriate and up to date.
If you look at those two websites, and they'll have reliable information on there.
No, that's lovely. And do I get can I just buy the ibuprofen from?
Yeah, if you just buy that over the counter, and then we'll book back for a couple of weeks to come back and see me.
No, that's lovely. Thank you.
Do you have any questions?
No, I don't think so. And then I just book. Do I just go and book?
Yep, so we can book that on your way out. I'll give you a slip to give to the receptionist to ask you to come back and see me in 2 weeks. But if you think things are changing before that, your headaches are getting more severe, just come back and we'll see you sooner. Okay.
That's lovely. Thank you very much.
Okay, thank you very much. Thank you.
So, how did Dr. Anu do? She took a structured history, addressed ideas, concerns and expectations smoothly whilst picking up on cues and asked about appropriate red flags. The examination was appropriate and the management was also patient-centred. Acupuncture is a viable preventative option for chronic tension headaches, which wasn't mentioned here. Despite this minor omission, she achieved a clear pass in all domains.